Well, to me, the Puna Pima means, working together as one. And I think with the Puna Pima bringing the Baby One program out, I think it's a good idea because the Baby One program supports the pregnant ladies up in the community. And with the Baby One program, we give education to the ladies, support, and encourage them to go to their antenatal visits with the midwife. And we also get to build that relationship with the ladies because we're with them from the first day they present to the clinic and then to baby when baby is 2.5. And that pretty much adds up to 1,000 days we're with them. When I go out to Napradom to do the home visits with the Baby One program, we have these topics and they're hard topics to cover, which are STIs, alcohol and domestic violence. I find that the ladies they don't really like to talk about it that much. And I think that's why the Baby One program is really good because they've got those topics in the program. Especially because I've only just started out as a health worker, it is a lot harder to approach those topics because with, say, senior health worker, they've done it for years and years, and with me, I've only just started. It'll be a lot more comfortable for the ladies to watch the videos. It's the icebreaker.
Everyone appears in this movie are actors from Napranam, so enjoy.
Good morning, Puna Pima, Clavanna speaking. Sorry, she's not in at the moment. Would you like me to take a message? Okay then, all right, bye.
Hey, hello sis, which way?
Yeah, good, thank you.
Oh, been meaning to chase you up today. Yeah, you had some blood results a couple of weeks ago.
Oh, yeah.
Is it all right if we do it today?
Yeah.
Yep. So just come in, sis, and just take a seat.
Looking forward for the photos, sis.
Yep.
Yeah.
I've got them right here for you. So you can see the bones and the mouth and that, the spine.
Technology these days.
Yeah. So the reason why I brought you in, let you know that a blood result came back and it was for an STI and it came back positive. A blood test that is positive for syphilis.
So how was I supposed to get it?
If you had sex with multiple partners or your partner might have had sex with multiple partners.
I only got one partner.
Okay.
But you're telling me that I got it. How?
It's through sex, unprotected sex.
So he must have been playing around.
Yes.
That's what you're trying to say? Because I get it from him.
There's no other way you can get an STI.
But this baby, all right?
The midwife can explain that to you. So, are you okay? How do
I
you
just
feel?
want to get this over and done because I need a cigarette. I'm stressing now. I might go pub. I'm just angry now. I just want my partner to come in.
Tomorrow, if you want me to, I can come around and just have a check on you and see how you're going. Is that
I don't
okay?
know, sister. I can't promise you anything. I might not be there.
But I'll definitely come and check up on you.
Yeah, you can come around, but I'm not gonna be home. I'm just telling you straight now.
All right then.
I don't know.
No worries. I'll get the midwife for you. And if anything, did you want me to sit in?
Yeah.
Yep.
I'm comfortable with you sitting
Yeah.
in.
And also that whatever is discussed in this room is confidential.
Okay.
Yeah. I'll just go and get the midwife to have a yarn with you.
Yeah.
Yep. Okay. I really, people have choices and they make choices because of their circumstances now, like what's happening in their life right now. And I'm not going to stop her. If she wants to go and have a cigarette, I can't really, that's her personal choice on what she wants to do. But maybe when she's calmed down and just thinking about it and just having, more conversations and then, working my way around.
I'm feeling very angry, very pissed off to go and just to receive a photo, but to find out that I've got a some sort of a disease that makes me more angry, and I just want to go out and drink and smoke and just want to fight with whoever that my partner was with.
I think like a lot of the time when you're talking to people, you can see like they're getting agitated and they're getting frustrated and more angrier. And it's not like you're trying to calm her down because she's wanting to have a fight. You're calming her down because you're trying to explain things to her, more or less, and not having, having her calm so she can be in a right frame of mind to think. Like, that's hard to do. Oh, hello, dear. This is Nikki, Nicole's midwife. So this is Patsy, and that's Nikki.
How are you doing? I've just had a chat with Deb just outside, and she's just showed me some of the results that I just wanted to have a chat to you more about. So Patsy, Deb's just told me that you've actually been told that you've got an infection that's called syphilis. And what this means to you is that you've got an infection that needs to be treated. From now on, I want you to try and keep yourself safe. No unprotected sexual intercourse, okay? Because we need to get in contact with your partner. Yeah. So with Bubby at the moment, Bubby's safe, okay? And we need to get onto the treatment straight away. It's only when, if you had active syphilis and you were giving birth vaginally, that your baby's at risk of getting the syphilis infection. But in the meantime, yourself and your partner will need to be treated, and any more contact names that he produces is very confidential, and we can't pass that information on to other people. It's very confidential, and we will do the
So I
contact
don't
tracing
know
with them.
my partner's.
Contacts, no. Patsy, I
I'm so
understand.
angry.
I can certainly understand how angry you are.
I wouldn't know how safe the baby's gonna be after going home now.
Yeah.
Just stressing. I
Yeah,
just might just go and drink.
Do you think drinking and smoking would solve this?
I don't know, sister. I'm so angry at the moment.
Just have a look at those pictures and just say to yourself that if I'm going to be drinking and smoking, that can actually harm the baby too as well.
Well, I don't know how I'm gonna deal with it when I get home. Can't make you promise.
We're just worried about you and about your baby.
I was looking for a healthy baby, but
Yeah.
You can still achieve a healthy baby, Patsy.
okay.
Okay.
All right then. Well, thanks for that, sis. Is there anything else that you want to know?
No, sis.
Okay then. All good. Look after yourself now. Patsy's always been a good mum. She's got a 4-year-old. She's looked after this pregnancy. She's a bit upset now that she's, a bombshell has dropped on her. But I think Patsy will go forward and, kind of look at her partner and think, what the hell have I been doing with this doogie all my life? You know what I mean? Like, I'm just hoping she'd just move on and, continue to look after her boy, and her new baby, how the way she's been looking after her other son too as well. And, single mum, strong Aboriginal women, living in a community and just looking after their babies.
Pregnancy is a really happy time in your life when you actually bring a new baby into your life and that you're going to be nurturing in. This time of her life, she feels a lot of betrayal and a lot of hurt, and that can be very significant in how this impacts on Patsy and how she then delivers the care to her children. So my aim is to try and sort of help Patsy overcome some of these hurdles and to explain to her that she's got choices here. When we look at our children, we have these planned pregnancies or even unplanned pregnancies, and you can see that cycle. If we don't make changes at that generational stage, then we continue to behave that way, then we can expect the next generation will continue to behave that way. And so we need to be just embracing and loving each other and sharing everything we can and show that love, because those younger generations can see that and say that's normal behaviour, and we can continue to love them.
chasing this lady. I don't know where she is. So I might try to at her house first. I'd pull up, I'd beep the horn, I'd just wind my windows down and call out and then walk towards the door. If the door's shut, I'd open the screen door and knock. If the kids turn up on the door, I'll just tend to ask them where their parents are. We don't tell them why. We just tell them that it is urgent, that we need to see them.
We say,
Morning, morning.
how are you?
Oh, look, sis, I'm just chasing your sister. Just wondering if she came home.
She's not here now, but she come last night.
Okay.
And she was this kind, and them to be a big fight.
Oh.
She's gone again now.
She was pretty upset too before, so I just wanted to touch base and see how she's travelling, but obviously she's off the handle now. But if you see her, can you just tell her that I'm looking for her, just for a yarn?
Okay.
Yeah.
I'll let her know.
All right then.
All
Yeah.
right.
Thank you. No worries.
See you.
Bye. I think now, given that she's been drinking, and if she's been in a situation where, she might have been fighting or defending herself, our main concern, like clinically, is the baby hurt? Has she had bruising or kicking, being knocked to the ground and being kicked at? To me, it's like I just want to eyeball her to make sure that she's okay and just yarn to her and see how she's travelling. Patsy's partner, Casanova, has been named as a contact for a positive syphilis. So we need to just kind of work out a plan how we're going to locate him and just have a yarn to him. First and foremost about his STI, and then again maybe in relation to the domestic violence.
Richard, Bala,
Hey, hello, Bala.
how are you?
Good, good.
I've been looking for you around here.
For what?
Have a seat first. Sit on the bus. And all them nurses been looking around for you this morning.
What?
They've been just telling me like you've been named contact, eh?
Oh,
For STI, we might have to treat you for STI and maybe get some contact tracing done to get
Aye.
them names for them woman. You might be. Yeah. There's also been talk from community. Look, you've been having problem at home, and we domestic violence. This is no culture, but you mean. It look bad from outside,
Oh,
bashing woman in front of kids and everyone.
true.
We look after our families, so it kind of look a little bit bad.
I have a bit of tipsy, bit of,
Big night, eh?
yeah.
If there's anything we can do, look, we can go and see them, Mowbray Men's Health and Men's Group. So they can do a referral for you for maybe seek help, like from counseling and ATODs who can help you from drinking and also domestic violence mob come up too. So just
to
come
me,
up
yeah.
clinic and we will have a yarn there. Oh, nice talking to you.
Thank you,
That's
Bala.
all.
Oh, sis, I've been looking for you.
Yeah,
They said they might find you down the beach here.
yeah, we come and cool off.
Oh, you've been in a fight.
Yes, yes.
So what happened?
I don't know, just gone and questioned him, and yeah, he came out with it, told me. Yeah, but glad I got it off my chest. And
Oh, okay. Doesn't look good, sis. Like proper worried about you. Yeah.
as long as the baby's gonna be all right.
Yeah. So, I could put you in, link you with the midwife that we were talking with earlier on. And maybe you're more than happy. There are counsellors that come through and have a yarn.
Yes, I think I really need that. I just realized now
Yeah.
how important it is for Bob
Yeah.
and myself, especially Bob. And
You don't need this, in your life. You're a strong mum. You've been, looking after your pickaninnies, especially your little boy now.
well, I'm gonna go into town and go to a woman's shelter for a bit. And
Yep.
get some guidance and help
Yep.
for them too as well.
Okay.
Yeah, but
Yeah.
yeah, love help and
Yeah. So we can do that. We can assist you with that
yeah.
and help you sort
Really love
yourself
that,
out.
yeah.
In relation to domestic violence, people are, they've gone to jail for it. And it's not something that we would like our women going through, and especially when they're pregnant. Well, you've been doing really well.
Yeah, I really thought about you and that midwife's conversation there. We had that small yarn and really opened my eyes. I did.
Well, we're always here for you if you ever need someone to yarn
thank
to.
you.
Yeah. You're welcome. Thanks for that. Do you want to lift home?
Yeah,
Yep. Okay then. Let's go.
I better give up the smoking to start now. I
Yeah, I
Yeah.
reckon. I said it'd be
it
good.
down to the thing. Yeah.
Oh,
Yeah.
good girl.
No, but yeah, we have good talk there and work things out. So for the best now, like good road down here.
We can just all say no to violence and not put up with it. So there's ways and means that a family can seek help, come to the clinic, come and see us. I'll talk to your local health worker, talk to your local police community liaison officers within communities, and just have a yarn to family groups like women's groups and men's group if there is violence occurring. So some of the violence that we recognise in community, some of them are like your physical violence, verbal abuse, whether it's towards your partner or towards a child, emotional violence, social abuse, keeping families or partners away from their friends and families, financial abuse, holding money or holding key card, and sexual abuse, spiritual abuse, separation violence, and stalking. So that's a form of violence, even on Facebook or on social media. And obviously, with domestic violence, there's domestic homicide. So in the end, somebody will, eventually have their life ended. And that's what we don't want to see. We don't want kids moving away. We don't want child safety taking our kids to other places and having them grow up in different areas. And it's not right for that family or the community, and also it's not right for the children, being deprived of not having other family members around to guide them to as well, but also having to walk on country. I think at the end of the day you just want to get in and make a small change. You don't think it's relevant to how you do your job, but it must have touched somebody. Like what you said on that day must have made a difference to that person's life. And getting out of bed and having to get ready and go to work, it's about, like today I want to make a change.